to this discussion on organ donation. As part of the Times of India's 175-year celebrations, iLead India brings you the organ donation campaign to create greater public awareness on the subject. August 6th is being designated as Organ Donation Day to create greater buzz among the public and to create more awareness. And so we have here with us a panel comprising of spiritual religious leaders, medical experts, a psychologist, as well as a person who from a family of an organ donor and a recipient, and also an NGO. And we will discuss here all the myths and the fears and the challenges being faced with regard to organ donation. So here we have Maulana Wahiduddin Khan. He is an Islamic scholar, peace promoter, and founder of the Center for Peace and Spirituality International. Then we have Ezekiel Isaac Malekar, priest of the Judah Hayam Synagogue, Delhi. And then we have Dr. Ramdeep Ray, consultant, liver transplantation, Apollo Hospitals, Delhi. Dr. Pulkit Sharma, psychologist who practices in Delhi. And Pallavi Kumar is executive director of the NGO Mohan Foundation, which has done sterling work in creating awareness and training transplant coordinators. Mohan Foundation was founded by Dr. Sunil Shroff of Chennai in order to create greater awareness on this issue. But before we start the discussion, let me also introduce to you Kanupriya, who is the mother of a child donor. And also we have the Roy family here with us, whose child is the recipient of an organ. And before we start the discussion, we will now play the video message from Sri Sri Ravi Shankar, the founder of the Art of Living Foundation, who is currently out of the country, but who is now going to speak to us via a video stream.
अंग दान करना भारत के लिए कोई नई चीज नहीं है। हमारे पुराणों में, हमारे इतिहास में भरा पड़ा है। लोग अपना अंग दान किया करते थे। कभी कभी मन में ये शंका आता है कोई अपना ऑर्गन डोनेशन कर दे तो उससे मुक्ति हो पाएगी, नहीं हो पाएगी। और ऐसे भी भ्रम लोगों में है कि कोई आंख दान कर देंगे तो फिर आंख फिर दोबारा अंधे बन के आना पड़ेगा दूसरे जन्म में। ये सब गलत फहमी है। आप बेशक निसंकोच अपना अंग दान कर सकते हैं, ऑर्गन डोनेशन कर सकते हैं। इसमें कोई क्षति नहीं होगी, किसी तरह से प्रगति में बाधा नहीं है। मुक्ति मिलने के लिए कोई किसी तरह का अवरोध भी नहीं है। इसलिए हम सब लोग बेशक अपना अंग दान कर सकते हैं। अंग दान कीजिए, उससे और पुण्य मिलेगा ताकि हम और लोगों के जीवन में के लिए उपयोगी बनेंगे। हमारा जीवन का रग रग यदि दूसरों के काम आ जाए, इससे बढ़िया पूजा कोई नहीं है, इससे श्रेष्ठ कोई और कर्म नहीं है। चले हम सब लोग अंग दान करने में आगे बढ़े। जय।
Before we begin the discussion, sorry, I made a mistake. I forgot to introduce Dr. Avinish Seth, who is the head of Fortis Organ Retrieval and Transplant, FORT Delhi. Dr. Ramdeep Ray is not here with us. My first question is to Maulana Sahib, because normally where organ donation is concerned, there are a lot of misconceptions regarding what religious scriptures say, and especially so in the case of Islam. So Maulana ji, what would you say is the Islamic perspective on organ donation?
Fine. I know that there are some Muslims who are against the organ donation, but it is their personal opinion. It is not the Islamic teachings. And you have to differentiate between personal opinion and the correct teaching of the religion. That is based on Quran and Hadith. I can say that all the religions, including Islam, emphasize on charity. It is a well-known fact. And I can say that organ donation is the noblest way of charity. You know, in charity we donate, in organ donation, we donate a living item, while other kind of donation are based on non-living items. So I can say that organ donation is the very unique kind of charity. And you know that organ cannot be made in any industry or in factory. Organ can be made only in natural factory. It's so unique. So it is very unique kind of charity to give some organ to your fellow being.
So, Maulana Sahib, is there any specific injunction in the Quran which says that you should give of yourself, which can be taken to mean that you should be able to also donate your organs?
According to my knowledge, there is no restriction at all. There is a verse in the Quran, Wamma Mayan for Nas pillars. It means that giving is the best deed in Islam. Giving is good. If you are living in a society, you have to live as a giving member of that society. So all kind of giving, including organ donation, is sadqa. Sadqa means charity. Then I would say that there is a concept in Islam that is sadqa jariya. Sadqa jariya means continuous charity. So when you donate some organ like eye, then you are giving your eye to a person that will live after your death. It means that it is continuous charity. So what a good idea that you are donating something to other, even when you are not in this world. So it is
something that outlives you.
Yes, it is very good. So in Islam, I don't know any teaching which restricts this kind of donation. Then there is a very important, organ donation is a very recent phenomenon. It is a invention of modern medical science. Before modern medical science, there was no such donation. And there is a very important principle in Islam, that is az-zururat tubihul mahzurat. It is based on law of necessity. It means that necessity makes unlawful lawful. So even if someone says that it is unlawful in Islam, so I would say that according to law of necessity, you have to make it lawful. Although there is no clear indication in Islam, any teaching in Quran and Hadith, that forbids organ donation.
Okay, thank you, Maulana Sahib. You have made that very clear. May I now ask you, Rabbi, to explain to us what does Judaism say about it?
In Judaism, you are aware that there are 613 commandments in the Bible, Old Testament, and the most important commandment in the Bible is in the book of Leviticus, chapter 19, verse 18. thou shalt love thy neighbor as thyself. Means the Jews have been commanded to show love, to demonstrate love for God as well as for fellow men. And the best act in the Judaism is to save a life, because according to Judaism, life is considered very sacred. And therefore, if we could save someone's life, transgressing some of the commandments, it is a very, very noble act. But of course, there is a misconception in our minds that Judaism prohibits organ donations. No. At the biblical time, this concept was not in the biblical time, because it was just experimental, with 50 years ago, and they thought that it could endanger our life. But now these medical procedures have proved that it is a very the simplified method. If you could give organ and save the life, and therefore it is said in Judaism, even in Talmud, it is said, if you save a life, it is a mitzvah. Pikoe nefesh. It is the highest spiritual and religious virtue in Judaism.
So there is
So
no,
there is
there
no
is no ban.
absolutely no this thing that, in fact, Judaism encourages, supports the concept of organ donations and transplantation.
Thank you. So now we've had the religious perspective given by Maulana Sahib and the Rabbi, and we do know that organ donation is also faces a lot of challenges, especially psychological, medical, and also like as being part of Mohan Foundation as an NGO might also face certain other peculiar problems. So Pallavi, would you like to say something about your experience with the Mohan Foundation?
See, as an organization, of course, we work very passionately to create awareness on organ donation, and the more we are going out there and the more we are talking to people, I believe that the root cause of the problem is lack of awareness. There is a very small group of people who may have religious objections. Let me be very honest here. The root cause is where has the average person on the road given the option to be an organ donor or not? Where has the average person ever been asked, do you want to be an organ donor or not? So the whole question of whether he agrees or disagrees is pretty redundant right now. Most often, the very first time the person is asked to take the decision is when somebody like Kanupriya must have, when they just lost somebody. So they are dealing with the death of a loved one, and suddenly they are thrust with this whole new difficult decision of having to donate whether they want to donate the organs. The idea is that this kind of a discussion takes place in families, in households, otherwise in normal circumstances. So people have had the chance to kind of mull over this issue, had the chance to decide the merits or the demerits of whether they want to be organ donors, so that they're not having to take a decision in very challenged situations like those.
So may I then raise one question, which is which any of you can choose to answer? Like, should we then have something like presumed consent? Like when a person dies, should it be presumed that yes, his organs can be his or her organs can be donated, or like how we have in India, do we have to then all be card-carrying donors in order for such a decision to be taken? Would you like to answer that, Dr.
Yes.
Dr. Avnish Seth?
See, the problem is that in our country, organ donation so far has had very negative connotations. So those of us who work in organ donation, we always feel that if you have a law like you have in Israel or like you have in
Spain, Austria,
where you can just have to, compulsorily you have to opt in unless you opt out. So that kind of a thing is not going to work in our country, because we have a very vast country and our command and control is not very good. So with the kind of negative things that have been associated with the organ donation, this may be a bit too radical to do right now. So I would just agree with Pallavi that awareness is the key to the whole thing. And right from school level, we need to talk about awareness at various fora. And also what happens is, what we find in our day-to-day working, the most difficult concept for the family to understand, again because of lack of awareness, is the concept of brain death. When you explain to somebody in the intensive care unit that, look, there's been a head injury and your loved one is no more, there is brain death, and at the same time they're watching on the monitor that the heart is still beating, it is very difficult for people who are hearing of this concept for the first time to come to terms with the fact that heart is still beating, but my loved one is dead. So again, it comes to education, awareness, and getting the basics right.
And also I'd like to add here, because I think one important aspect of awareness is that, that we need to also educate people about and take care of, various emotional factors. Like, if we are talking from the side of the donor, because many people, no one really has an experience of death, or no one knows, how is it going to be when they die. And people have grown up identifying their self with their body, when they see their image in the mirror every day, so they identify the self with the body. So they feel that, they have this fantasy that when I'll die, I'll be going with this form. And that's why, many of them are very resistant to this idea, that my body will be cut or something like that, So that's one reason from the side of the donor. From the side of the family, I feel that, as my colleague was saying, that they somewhere have a lot of emotional attachment to the person. So when the person is brain dead, or even when the person is dead, they are still seeing the person, like that, and they feel that an act of, many people have shared that, that an act of organ donation would involve, cutting and mutilating the body, and they feel it as a form of violence. So these reasons need to be taken care of.
But we do have a wonderful example here of Kanupriya. She is the mother of a little child who did suffer brain death, and she had the courage and the vision to be able to give up her little girl's body up for organ donation. Can you tell us a little bit about that?
Actually, it was not that difficult for me, because we were prepared for it. As I told you before, that we have read some article in Times of India 1 year before, I think, that one father who donated organs of his son. So when doctor was saying us that she's going to be brain dead person in few days.
And your daughter was how old?
Yeah, she was 4.5 years that time, and her brain was damaged, actually for 90% damage for 4 years.
Since birth,
yes, since birth. Just after 15 days of her age, she was declared with meningitis. Then she developed ventriculitis and hydrocephalus. Then she passed through 4 brain surgeries in 2 years only, and we put her on every therapy we could do. Even stem cells and everything we have tried for her, which was available that time. But after just last shunt operation in AIIMS, doctor told us that now she's not going to survive. In 15 days, we put her in Sitaram Bhartiya Hospital, and then they told, just after putting her, she went into coma, and doctor told us about her condition.
He explained to you that she's
yes, and we were making ourselves ready for that. Okay, she's not going to be with us anymore.
So did the entire family agree with your decision to?
Actually, it was just in the last few days when we were just struggling with the fact that we need to put her off from ventilator. We were not ready for that. But doctor told us that no, she's brain dead. So they went through brain death procedures, and then they told us that are you ready for the organ donation? And there was no problem with us, because we were ready, and we told them that okay, how many organs you want, you take. So I want them just to be utilized. That's my only concern. If they will be utilized, they will save the life of people, then I'm very happy. If not, then
and you did mention that you came to know that 5 people.
Yes, after 1 year in Apollo Hospital, they told us that there were 5. Yes,
because of your little daughter.
Yeah.
Yes, Rafa, you want to say?
You know, I would like to add that in Israel, recently on the 28th of June, my aunt, Mrs. Dinah Benjamin, she passed away. And according to her will, she says, my entire body has to be given to the science for legitimate medical purposes. So the entire body was given to the hospital for the medical purpose. And in, as you have rightly said, in Israel there is a very, very great awareness, and because in Israel and other countries we discuss about this topic openly. In India, what happened? We want to discuss this within the
Closeted,
So as you have suggested, in schools and colleges, and in Israel there are 70,000 the donors who are means prepared to donate their organs. 70,000, whereas in India last year there were only 110 donors, and there are 150,000 the patients are waiting for the organs to survive. So unless and until we create this awareness, and second point which we have raised, they have that presumed consent. If the brain is dead, also the heart beating and all, that is only he is a terminally ill, only clinically he has been kept alive. So presumed presumed consent, and they have the non-medical approach. One is the medical approach, one is the non-medical approach. And that there are small countries, not even 8 million people, and there are more than 70,000 donors willing to, because to save someone's life is the highest.
This is you're saying the 70,000 donors, despite the fact that this is already there. Presumed consent is already there.
Not only that,
They just want to make sure.
Recently, in Israel, the Arabs and Jews, the Christians, they live together. Whether the Arab boy or Christian Jewish girl, if somebody's body is to be used, they try to create that bridge to peace.
That's wonderful.
There is awareness has to be created. Unfortunately, in India, we religious leaders has to do something and tell our own congregation that look here, that it is because they have the misconception in their minds that giving organs or donating organs is against the religious beliefs. No, as Maulana Ji said, it is all religious. What he said about the charity, we talk in Judaism about tzedakah. So it is a very, very most the pious deed which you could do.
We also have with us the father of an organ recipient, Kamal Roy. He's in the Navy, and his little daughter is the recipient of transplanted liver. And can you say something about your experience?
Yes, my little daughter Jagriti, she at the age of 1 year, doctor told that her liver has been damaged, she needs to be transplanted. At the time of her birth, she was born with jaundice. Since then, the liver started deteriorating. I visited many hospitals, but doctor told that the bile duct is blocked and this cannot be corrected by applying medicine or any operations. Only way is the liver transplantation. Then I came here, Delhi, at RR hospital. Their doctors advised me that this is very risky and you have to arrange your donor.
Risky for your daughter?
For the daughter, and the child was very weak. It was very risky for the daughter to transplant at this time, but there is no other option other than liver transplantation. But you have to arrange the donor. My wife was agree, but doctor tested for my wife also. But day before the plant transplantation, we got a diseased liver from AIMS hospital. We don't know who was that boy. I know that he was only 8 years old. When the doctors got her liver from AIMS and she was transplanted at RR hospital just 2 years back.
So
After,
it was another child who had died.
Who died? I don't know who was.
Okay. and then you, so your daughter benefited from the organ transplant. And is she there with you here? No?
She has gone out.
Gone out. She's a very lively
Yeah.
little child and very naughty. I can see that.
Very naughty.
So she is leading almost a normal kind of life. But you did mention that she has to be on immunosuppressants,
Yes.
probably for life. So
Yes.
is that a problem, or is that?
No, she has to take medicine daily, time at morning 5 o'clock and evening 5 o'clock. Before taking the medicine, she has to take 2 hour fasting, and after taking the medicine, she has to take 2 hour fasting. It is very difficult at this age. She want to take something
How
in
old
between.
is she now? You
She
said
is
she's
3 years
3
old.
years old. Yeah. Mhm.
At this stage, it is very difficult. Otherwise, when she was small,
Mhm.
that was not so difficult.
Yeah.
Other than these medicines, also she is taking other 2-3 medicines at this time, but this medicine will continue lifelong, as
But-
doctor told me.
And so you are happy that you took the decision to go in for a liver transplant,
Of course, madam.
despite the risks that
Yes,
was cited.
But otherwise, there was no other option. Madam. We have to go for transplant at this stage. Otherwise,
Yes. So psychologically, I mean, I'll ask Dr. Pulkit Sharma, of course. But did you feel anything? I mean, like, what were your feelings? Like, you had no problems in, did you have fears that what would happen to her after the transplant, and how will we manage, and that sort of a thing? Or all those things have been ironed out now? Now you're okay.
now she is fine after 2 years. But 5-6 months after liver transplant, she got some more problems.
Mhm.
CMV infections and
Because of the immunosuppressants.
because she was admitted to a hospital after for 5 months, continuously for 5 months.
So-
After that also she was there for 2-3 times for 2-3 days. Liver biopsy and other tests were conducted there.
But otherwise, now she's leading almost
Now
a
she is
normal
okay,
life.
but little bit problem is there, but no problem. Doctors are there;
You're
they are
happy
helping
that
us.
she is alive
She has
and
grown
well.
a lot. She is fine now. I am very happy.
Okay. So, doctor, I would like to ask you that what are the challenges for both for a say for a patient who has received an organ transplant? They have to be on lifelong medication for immunosuppression so that the organ is not rejected. So, what kind of awareness has to be created with regard to this?
I think that's a very important part when we counsel the family, when we select people for organ transplants. We make sure that they are in a position to understand the importance, that it is not just a one-time thing. Because your body would reject the liver or the kidney or any organ unless you take lifelong immunosuppressants. And they come with a cost. Like the Navy would provide the medicines to
You
the baby.
did mention that you were in the army as well.
I was, yes. We
and
set
that
up
you
the
set up
yes. We set up the armed forces, the called AOTA program, Armed Forces Organ Retrieval and Transplantation. And I think we've done now more than 50 people who have donated all their organs after they were brain dead. And the thing is that immunosuppression is something which costs money. It is almost about 20,000 rupees a month for the cost of the medicines and then the repeated blood levels of the medicines that we have to do. So I think our government has to step in and reduce the cost of these medications, which are so important. A common person cannot afford that kind of cost. Another thing I would like to talk about, as brought out for the little baby here, is the risk of live donation. I think this is the right time to bring it up because live donation carries a lot of risk, and this is something which we all must understand, especially a liver donation. A kidney donation, when there are two separate kidneys and you can
what you
take
call
one
paired organs,
it's much easier. But for liver, liver donation is fraught with risk because we've had at least 20 odd people all over the world who have died donating, and about 30% of the time you will get some kind of donor related morbidity to the donor. So living donation is not a very good option.
which is all the more reason why we need to promote and create awareness
Absolutely.
about cadaver.
I'll give you an example. In the United States, they do almost 10,000 liver transplants in a year, but out of that, 9,950 are cadaveric. So the developed world, if you see the European countries, if you see the US, they do not do liver transplants with the live donor program. So we are doing it out of a necessity. And now that as you have raised this campaign, it's a very nice time to make people aware.
So what role do you think hospitals can play in this? Because when patients are terminally ill, or they are in an accident case, or you know that they're going to die, so is that the right time? Although of course it's a very sensitive and emotional time for the family, in case they are not already organ donors, do you think it's the right time to broach the topic with the family?
Absolutely. From our experience, we find that we are, when it comes to the art of giving to somebody, the Indians are as good as anywhere in the world. I can tell you that we've had about 50 donations in the armed forces, and after that I've been associated with another 10 donations in the civil street, and the acceptance rate in our country is about 50%. That means if you ask about 100 families for organ donation, 40 to 50% of the time people say yes. And the same figure we have from Mohan Foundation, same figure from any organization which has bent its back and tried.
Like for instance, in Kanupriya's case, she was aware, she was already aware of it.
Yes.
And she was an informed, mother of a donor, in the sense she took the decision in almost a flash, I think. However, there are others who may not mind giving, but they may not even be aware that such an option.
We just have to make processes more easier. We just have to
What would you suggest? What would you suggest?
There is enough talk about HIV. There are hoardings on malaria. There are hoardings on dengue. Where is there any awareness material put up on organ donation? It should be there. If you walk into a hospital,
blood donation,
there's enough for blood donation.
Eye donation.
There's even for eye donation. You talk to a group of 50 people and you ask them how many of you are eye donors. Probably a hand or two will go up. Organ donor, as a rule, nobody has ever signed up because nobody has ever known how to do it. As simple as that. They don't know where to go.
Yeah,
Every hospital should have. Sorry.
Yeah, I was saying that that one more important aspect of this awareness campaign should be sharing the survival stories. That how someone was
More
there who
positive
had a
stories in the
failing.
media.
So we need those detailed stories and maybe clips from those people, messages from the family and from the person who has received the organ, that how it made difference to their life.
It's so closeted, so simply Maulana ji put it. I thought it was such a sweet statement he made. He's saying, what a good idea to give something that you don't. What a good idea. I mean, how lovely to be able to give away something that you don't need and save lives, not one, not two, but at least 5,
which
7.
outlasts you.
Which outlasts you.
And it costs nothing.
That's what it is.
It costs nothing.
Nothing.
But a gorgeous
that's
idea.
Important point.
And such a senior religious leader saying that. I mean, what is your
Also, one point
Yes,
point that as Pallavi said, that awareness is very important, because at that time is a very critical time when someone, the dear one, is dying, and at that moment when doctor talk about something donation kind of thing, maybe people don't want to even listen, don't want to even think about it, and doctors even cannot force them or try them to make understand that okay, this is a good thing, because that time they are they are
and many times they're also in anger. See, because when someone is ill, and if you take them to the hospital and they go on a worse course, or you're not able to, the family also has a lot of anger and rage. So I think all these feelings need to be taken care of, and a consistent campaign outside the hospitals throughout the general population, I think that will be more effective.
In the hospital premises, there should be some hoardings, like if someone is going, you can donate.
Messages, hoardings, than people coming actively and saying that.
Unlike a few proactive hospitals here who are actually talking about organ donation, and if you go to a hospital, nobody will ever speak to you about organ donation.
So then, Dr. Seth, do you think there is a need to have, counselors for the family of terminally ill patients, so that in the course of their stay in the hospital, they can kind of go around, get to know them, and gently explain to them what the options are? Is there such a system, or?
We have trained counselors in our country, but very few. And I must compliment Mohan Foundation for taking it on, for training the counselors. But we also find that in our day-to-day system, counselor's role is important, but then the role of the treating physician is also very important. You know, in our country, especially in the non-government sector, you'll find that the GP or the general practitioner is the one that the family listens to quite a bit for everything. Whom to go for surgery to, where to get any blood test done, they will ask the general practitioner. So we have thought out a plan that we must involve the general practitioner, and we also must involve the treating person who has been dealing with them, the neurosurgeon, neurophysician. If they break the news to them that the patient is brain dead and then hand over to the next person, it's so much better. So transplant coordinators are very important, but in our country we find it's a bit difficult if they get into the ICUs on a routine basis. It's something which the doctors may not like. So transplant coordinators are important, but at the appropriate time. The person who is very important is the general practitioner, the GP, and the news has to be broken down by the neurophysician, the neurosurgeon themselves.
And I think that this team also, they need to be given proper training, because when we are going to a family, who is in a bereaved state, for organ donation, we are not just going there very mechanically with this agenda that, oh, now the person is dead, give us your the organs. I think the whole team has to be very sensitive to their feelings, talk to them about their feelings, take care of those feelings, and then very gently proceed towards this topic.
Right, and this is not something that can be delayed for a very long time, because
certainly
one has to act swiftly.
Yes, but I can tell you that whenever we talk to families, it takes time. There's hardly ever a family that will immediately say yes. So whenever we talk to families, we always give them time. So they will come back to you after 4 hours, 6 hours, and then have another meeting, another 4 hours, 6 hours. Time is short, but then they need time to think it out.
Also, Dr. Sharma recently wrote that he talked about a particular case where a person used to be very depressed,
and then would suffer from a lot of death anxiety.
Anxiety. And the moment he became an organ donor, his whole life got transformed. Can you say a little bit about that?
So there was this person, and as I was talking in the beginning, that people generally identify with their body, so when they're growing old or they are ill, they
obsessiveness.
So they get more obsessive about their body, and they have this fear that I'll die, I'll be finished, So there was this person who had a lot of such anxiety, and he went through counseling, and he went into spirituality as well, side by side at the same time. And after that, he came up with this idea, that after I die, I would donate my organs. And he kind of, he got out of that, limited sense of, self. And he, in fact, could, he had, in fact, a spiritual experience where
he transcended his body, so to speak.
Where he said that I now feel connected to everyone in general, and I'm so happy. I now get a sense that I would not, die and, become a black hole sort of thing, but I go living on, So that was the transformation he experienced.
To make a point, because the same thing was with me, because 4.5 years, Vinya was like suffering.
Vinya, your daughter?
Yes, my daughter was suffering for everything. Whole body veins were pricked, and there was no vein to putting cannula there, and surgeries and all, and she was not living. She could not see, she could not speak, she could not move, she could not do anything. So this donating idea was with me, like that, okay, at least her life was worth for something. Her life not wasted.
She did not suffer in vain.
Yes. So this was also thing in back of my mind, her life was not wasted. At least 5
positive
people. Yes, definitely.
So in fact, perhaps if like NGOs like yourself, and even hospitals, and if people like Kanupriya could actually, be roped into convince.
I want to.
Yes,
I wanted to tell her after this meeting that if I can join in some way.
That would be
because it's very easy for organizations like us to say it's a noble deed, or for religious leaders to
but
say.
You've been through it.
You've
been through it. You've experienced the pain and the suffering, and you've also experienced the feeling of giving life, and that your daughter's life was not wasted. So I think she would be an excellent ambassador of, this whole cause.
And as Pallavi has suggested,
that hoardings, like I've seen at the medical
It's just
aims
that one
also.
lone
So,
hoarding
like,
in
there
the
are-
whole of Delhi NCR.
Like there are many, like I remember that famous bumper sticker, do not take your organs to heaven.
God
Heaven
knows.
that we
They are
need those
needed here.
organs here itself.
Yes.
And the second one is to save a life is like to save a universe. And madam, one point I would like to make it here, that we must distinguish between the or, organ donation during the lifetime and after death.
Yes.
Right.
During lifetime, you can donate your kidney, bone marrow. Now we are
Blood.
donating,
Blood.
the blood also. So, but that awareness has to be created.
Yes, awareness is.
Maulana Sahib, would you like to add something to the discussion? Would you like to say something?
There's enough. My brother is very competent to throw light on these matters.
But have
I,
you?
I agree with your ideas.
Because what, madam, in Judaism and Islam, we think that by donating organ or any part of this thing body, that desecration of the dead or delaying the burials,
Mhm.
it gives pains to the very orthodox people. Am I right, Maulana ji? When
No,
we
but-
donate the organs, then there is a belief that you are delaying the burials. And many people, they don't like it.
So, no, but Maulana Sahib has said that just because you donate an organ, it doesn't
Yeah.
mean that you are somehow incomplete or
No,
You're
no,
not-
not.
Not incomplete.
Delaying
Suppose a person delaying, suppose
last
person
rites.
dies,
I see.
it takes a whole day
oh, I see.
Yeah.
to, so that is
And
the
to bring them
point.
for the last
So
rites.
ask Maulana,
Yeah.
Maulana Sahib.
Yeah.
Maulana Sahib, what do you have to say to that about this thing, about delay and?
No, I don't. I will not subscribe with this idea. One point I want to add that when we donate some organ to other person, we lose nothing.
You lose nothing.
Nothing.
Hmm.
And if you give some money, then you are losing some money.
Mhm.
But when you give some organ, that is very good kind of sadaqah, that is charity. That without losing something, you are giving others
Yes,
something.
absolutely.
Yes.
It is very important.
It is honor to the dead
Ah.
person.
So, Kanukya,
Yes.
you wanted to say something?
There was little resistance in our family too. Means few people told us that don't go for it because after in rebirth time she will not have eyes and she will not have these kind of things. So I just want to say that no religion tells it that this is good or bad. Superstitions are in every religion. So awareness is the only thing which can be spread, and because otherwise the body is going to be buried or
Yeah.
it's going to be burned.
Yeah, that is one problem we face
Yeah.
day to day. That in India, like in the Western countries, when like we were there, you'll find merely one or two relatives would come in and you would be counseling them.
Mhm.
In our country, when somebody is very unwell, sometimes you have 15, 20 people from a family, and then that is where our coordinators gradually have learned how to deal with it, how you identify the 2 or 3 people who seem to be the decision makers, who are the most balanced people.
But
And then-
correct me if I'm wrong, I think the next of kin would be just one person, right? Who would need to give the permission?
We need basically permission from the near relative. We say that
Either
the
spouse
person who's in
or-
person who's
or
in
parent.
possession of the body,
Uh-huh.
but then that one person who's signing, for example, the spouse or the parent, his decision
Is influenced
is
by many
not only
others.
influenced, but once he signs, then he's signing on everyone's behalf too.
Mhm.
So we always make sure that maybe 2 or 3 people can sign to just make it
Make it
very clear for the whole
clear,
family.
yeah.
But yes, we have a problem where a lot of people come together.
Uh-huh. So, yeah, sorry.
And that is why it is so important for hospitals to have dedicated staff for this work. It can't just be done by anybody because doctors don't have that kind of time, you know. We recently had a donation about 15 days ago at a hospital, and I started talking to the family at 2 o'clock one afternoon. And the family said yes, 4 o'clock the next. It was 26 hours of speaking to mamas and chachajis and, you know, brothers and sisters. There was anger, there was grief, there was doubts. Where will the organs go? Who will use them? So someone has to be with the family constantly. You cannot underestimate the need to have dedicated counselors or transplant coordinators or whatever you may want to call them for this work in hospitals if it has to be successful.
Yes. And this awareness thing, when we talk about awareness in the hospital staff, is equally important as when we talk of awareness the general public. Because what happens is, as we have discussed, it takes 12 hours, 24 hours for the family to say yes. Hardly ever they say yes straight away. So the hospital, the intensive care people have to be aware, and there is something called donor maintenance. If you follow a particular protocol and continue the treatment, we find that for 48 hours, 72 hours, we can maintain and allow the family to have a decision. Whereas in our country, the problem we face is that in the hospitals where there is not much awareness, where the staff is not trained, there is brain death, and very quickly, the next 6 hours, 8 hours, the things go out of control and there is multi-organ failure and you can't take organs. So the awareness of the staff to start the donor maintenance protocol, to maintain, wait 24 hours, 48 hours, nothing happens. 72 hours, 96 hours again also we have taken the organs.
So when you studied medicine, when you went to college, was this part of, were you instructed on?
No, it's actually shocking because I did MBBS, I did my MD medicine, I taught MD medicine in one of the best medical colleges, then I did my doctorate in gastroenterology, and I had not heard of organ donation. It's absolutely shocking. I had to go to England for 6 months to work on liver transplants, and then I realized that, my God, what have we been up to? But we came back, our team came back, and we made a concerted effort, and we did succeed in having organ donation. And we realized that it's not that our people are bad, it's just that we never asked nicely, we never had our systems in place. And then this is our experience.
Don't know that such an option exists.
And this is our experience with Fortis hospitals now, and before that also. Once you put systems in place, things would happen. If you do not know what forms to fill in the middle of the night, if you do not know what law to follow, then everybody runs in the opposite direction. That's where the training of the hospital staff is very important. So you have to be able to look the family in the eye with conviction and tell them, we will lead you through it. There will not be a problem. We will hand your body back in time. We will not have any mutilation of your body. Your postmortem will not be delayed. So all those things have to be put in place, and the people have to have a confidence in view that, okay, this is the one organization where it can happen, and also that the organs will not go to the rich and the mighty. We must have a very good organ sharing system so that it goes by the need of the person and not anything else.
So thank you very much.
I would like to ask Pallavi ji, because I have come across many cases while working in the National Human Rights Commission, and I'm the member of the Ethics Committee of the Lady Hardinge College and Ram Manohar Lohia Hospital. Many persons, they give up, like on the 6th of August we have this donating organs.
Organ donation day.
And the pledge, many persons I've seen, they have donated their eyes. But what happens after his death? His relatives, they refuse to, hospital to, donate the eyes.
But that is where
the family discussion comes in.
Because out of emotional and sentimental, this discomfort, they simply say no. You would not. Though my husband has pledged his eyes, but I would not like to, donate his eyes. So the family members are more.
So we need to create awareness amongst everybody.
And we are attuned to consider, death as the end. We should say that death is not the end; it's a new beginning. So with that, we should.
On that note, I think we can now conclude this little discussion. Thank you so much for being here. We got the spiritual perspective from Maulana Sahib and Rabbi, and from Sri Ravi Shankar, and we had the medical perspective from Dr. Seth and Dr. Sharma, and Pallavi spoke about all the challenges being faced by NGOs, and we had the very touching and emotional account from Kanupriya, who is now determined to take part in creating greater
Yes.
public awareness.
If I get
And
the
thank you,
opportunity.
Kamal Roy, for sharing your experience with us. Thank you very much. And just remember, August 6th, Organ Donation Day, and be sure to spread the word. Thank you.
Thank you.